This conference will now be recorded.
Okay. So in this session, we are going to see about the nasal cavity. Okay. So nasal cavity, first we'll see the general features of the nasal cavity and what are the boundaries of the nasal cavity. Then we'll see the medial wall today. Okay, in the next session, we will see the lateral wall. Okay, so this nose functions both as respiratory passage and the organ of smell. Actually, this organ of smell is mainly the olfactory receptors are located in the olfactory mucosa in the upper one-third of the roof of the nasal cavity. The remaining all are it is covered by respiratory mucosa. So this respiratory mucosa provided with rich blood supply. So that's why it warms the inspired air, and it is also provided with numerous serous and mucus glands, so which will trap the dust particles. Okay, and even it is provided with cilia, which traps the dust particle, and it will be swallowed. It will go to the nasopharynx and it will be swallowed, and through GIT it will be eliminated. Okay, and if you see, actually the nose, it consists of two parts. They are the external nose and the nasal cavity. So first we'll see about the external nose. Okay, so if you see the parts of the external nose, it has a actually the external nose has a pyramidal projection. So the pyramidal projection, at one point it has a pointing apex or tip of the nose. Then you can see there will be a depression just below the frontal bone. This part is called as the root of the nose. Then the part which extends from root to tip, this part is called as the dorsum of the nose. Okay, so on either side the dorsum end as a soft projection, that is called as the ala of the nose. Okay, and you can see the opening of the external nose. There will be two opening in the anterior part. They are called as anterior nares or nostril. Okay, so this nostril is separated by a mobile nasal septum in the middle. Okay, so these are the parts of the external nose. So the external nose is made up of both bony and cartilaginous part, and the external nose, if you see, it is covered by skin. The skin, if you see over the bony part, it is loose, but if you see over the cartilaginous part, it is thick and adherent to the cartilaginous part here. Okay, so this external nose, if you see, it is supplied by external nasal branch of anterior ethmoidal nerve and branches from the infraorbital nerve. Also supplies the external nose. Okay, so like by the artery also, it is supplied by the branches of facial artery, and the infraorbital artery nasal branches will supply the nose. Okay, and even this infratracheal artery, which also supplies the external part of the nose. Okay, if you see the skeletal framework of the external nose, it is made up of both bone and cartilage. Okay, you can see in this picture. So it is made up of both bone and the cartilages. If you see the bony part of the externals, it is mainly formed by the nasal bone. There are two nasal bone connected by internasal suture, and on the side you have the frontal process of the maxilla, and in above this you can see the nasal process of the frontal bone. So these are the bones which contribute to the formation of the external nose. Okay, and if you see the cartilageous part, the anterior part of the external nose is replaced by the cartilage. So this is formed by nasal cartilage. Okay, this nasal cartilage is two, superior nasal cartilage and inferior nasal cartilage. On the sides you have small alar cartilages. Okay, you can see the small alar cartilages, and in the middle, which you have the nasal septum, that part you have the septal process of the inferior nasal cartilage which extend. Okay, and it forms a part of nasal septum. Okay, so I think now you are clear about the skeletal framework of external nose. I once again I'm repeating. So it is external nose is made up of both bone and cartilage. So bone is formed by the nasal bone, frontal process of maxilla, and the nasal process of the frontal bone. So the cartilaginous part is made up of nasal cartilage, superior and inferior nasal cartilage. Okay, the superior nasal cartilage is also otherwise called lateral nasal cartilage, and the inferior nasal cartilage is also otherwise called major alar cartilage. Okay, on the side you have smaller alar cartilages. Okay, this inferior nasal cartilage extends into the nasal septum. It forms the mobile part of the nasal septum. Okay, so we'll go on to the anterior nas. You can see the anterior nas, and you can see the extension of the inferior nasal cartilage to form the septal uh, cartilage here. So one more cartilage also there, that is septal cartilage. So the bony projection just below the nasal septum, this is called the anterior nasal spine. That is nothing but the two maxilla bone unite in the anterior part to form a projection. This is called anterior nasal spine. Okay. So now we'll see the about the nasal cavity. So far we have seen the external nose. Next we'll see about the nasal cavity. Okay. So if you see this picture, the nasal cavity extends from anterior nas or external nas to the posterior nas or cone. Okay, the posterior nasal aperture, or it is otherwise called posterior nas or cone. So anterior nas or nostril. Okay, so this posterior nas behind it communicates with the nasopharynx. It is communicating with the nasopharynx. Okay. So if you see the extension of the nasal cavity, it extends from anterior nas to the posterior nas. Okay. And if you see the nasal cavity is divided into two halves, right and left half, by a nasal septum here. The nasal septum divides the nasal cavity into two halves. So now if you see the each half of the nasal cavity, it consists of a roof, floor, and it has a medial wall and it has a lateral wall. So the medial wall is formed by the nasal septum, and this is the lateral wall. And you have a roof and the floor. Okay. Now we'll see about the anterior nares or nostrils. So this anterior nares or nostril is made up of both cartilage and the bone. Okay. So this, if you see the cartilage part, it is so contributed by the inferior nasal cartilage or major alar cartilage, and also the septal process of inferior nasal cartilage and septal cartilage. Okay, so this part is mobile. The cartilaginous part of the nose is mobile, and you can move this. Okay, so this cartilaginous part behind it joins with the bony part. This is the nasal bone, and this is the frontal process of the maxilla, and this is the crust of the palatine process of the maxilla. Okay, and this is the anterior nasal spine. In the lateral wall, you can see the projections here. Okay. Now next we'll see about the cone or posterior nasal aperture. So this is the posterior view of the cone. Okay, and in the middle you can see the nasal septum. Okay, so and this is the superior part which is formed by the horizontal plate of the palatine bone, and inferiorly it is formed by the mainly by the sphenoid bone, body of the sphenoid bone, and laterally by the medial pterygoid plate. Okay, so now I'll show the next picture. Okay, so this is the cone. You can see this is the posterior view of the this inferior view of the skull. In this you can see the posterior nasal aperture or cone. Okay, so which is bounded medially by the vomer bone, above by the posterior margin of the hard palate here. Okay, and laterally by the medial pterygoid plate. Okay, and below it by the body of the sphenoid bone. This is the body of the sphenoid bone. Okay, so in this plate here it it communicates with the nasopharynx. Okay, now next we'll go on to the roof of the nasal cavity. Okay, so first understand this picture. This is a sagittal section of the nasal cavity. So you can see the bony parts here. The yellow color bone is the frontal bone with the frontal air sinus. Okay, and this here the light pink color is the nasal bone, and these are the superior nasal cartilage, and you can see the lateral nasal cartilage. Okay, and this is the ethmoid bone. This entire pink color is ethmoid bone, and this is the sphenoid bone. Okay, you can see the sphenoidal sinus. So this is the body of the sphenoid which joins with the basi occiput here. Okay, and here is the medial pterygoid plate, and this bone is a perpendicular plate of the palatine bone, and this is the maxilla. You can see the palatine process of maxilla, and this is the horizontal plate of the palatine. Okay, I think now you are clear with the bones of forming the nasal cavity. Okay, now the roof is formed by, see, this is the roof of the nasal cavity. So the roof is not straight. Anteriorly it slopes downward and forward, and middle part, if you see, it is horizontal. The posteriorly it slopes downwards and backwards. Okay, so the anterior slope of the roof is formed by the nasal spine of the frontal bone here, then nasal bone and nasal cartilage. Okay, so the middle horizontal part is formed by the cribriform plate of ethmoid. Okay, so the posterior slope here, it is formed by the body of the sphenoid bone. So this is the body of the sphenoid bone which is formed by, which forms the posterior slope of the roof. Okay, so now the roof is formed by nasal cartilage, nasal bone, nasal spine of frontal bone, cribriform plate of ethmoid, and body of the sphenoid. Okay, so that's all about the roof. Next, we'll see about the floor of the nasal cavity. So the floor of the nasal cavity, this is the floor of the nasal cavity. Again, you can see here the inferior view of the skull, that is norma basalis. So the floor of the nasal cavity is formed by palatine process of maxilla in horizontal plate of the palatine bone. So in short, the floor is formed by upper surface of the hard palate. Okay. So I think now you are clear with the roof and the floor of the nasal cavity. So next important thing we are going to see about the medial wall of the nasal cavity. It is otherwise called nasal septum. It is a very important 5-mark question and important discussion topic also, and very easy topic also to read and to score mark. Okay. So the medial wall of the nose is otherwise called nasal septum. Okay. You can see the nasal septum. So this nasal septum is a median osteocartilaginous partition which divides the nasal cavity into two halves. So that means osteocartilaginous means it is made up of both bone and cartilage. Okay, so it is the skeletal framework of the nasal septum is formed both by the bone and the cartilaginous part. So it consists of bony part and cartilaginous part. Okay, so now here also you first understand the picture. So the previous picture what you have seen is the lateral, after removing the septum you have seen. Now along with nasal septum you are seeing the sagittal section of the nasal cavity. Okay, now see the same bones only here, frontal nasal bone, and you have, in spite of lateral nasal cartilage, you have the septal cartilage here, and here you can see the perpendicular plate of the ethmoid bone and same body of sphenoid, and here you can see the vomer bone. Okay, this is the difference in the nasal septum. Now we'll see the formation of the nasal septum. Okay, formation of the nasal septum. So the nasal septum is formed both by the bony part and the cartilaginous part. So the posterior superior part of the nasal septum. Okay, you divide the nasal septum like this. Okay, draw a nasal septum like this. Okay, and divide this into three parts. Okay, the posterior superior part, antero-inferior part, and posterior-inferior part. So now you draw a vertical line from the sphenoid bone to the anterior 1/3 of the hard palate here, which divides this into anterior and posterior part. Okay, the anterior part again divide this into two parts. Okay, from the crest of the nasal bone to the vertical line here. Okay, so this part is the posterior superior part of the nasal septum, which is formed by the perpendicular plate of the palatine bone, and the posterior inferior part of the nasal septum is formed by vomer. Okay, so these are the two major bones contribute to the formation of the nasal septum. So you have to keep it in mind. So the bony part of the nasal septum is formed mainly by two bones. One is the perpendicular plate of ethmoid, another one is the vomer. So the posterior superior part of nasal septum is formed by perpendicular plate of ethmoid, and posterior inferior part of the nasal septum is formed by vomer. Okay, and other bones contributing to the nasal septum are, so you can see the perpendicular plate of ethmoid bone here articulates with the nasal spine of frontal bone and the crest of the nasal bone, and you can even see the crest of the maxillary bone and palatine bone, and you can see the sphenoidal crest which is formed by the rostrum of the sphenoid bone. So these are the bone additionally contributes to the formation of the nasal septum. Okay, so you have to keep only two things in mind: perpendicular plate of ethmoid and vomer. You should not forget this. Okay, so next we'll go on to the cartilaginous part of the nasal septum. So the antero-inferior part of the nasal septum is formed by cartilage. So there are two cartilage here. One is the septal cartilage and septal process of the inferior nasal cartilage. So these are the two cartilages which take part in the formation of the nasal septum. Okay. So now the lower part of the cartilaginous part of the nasal septum is called columella. Okay, columella, columella. Okay, so the lower part of the septal nasal cartilage here is called as the columella. Okay, so I think now you're clear about the formation of the nasal septum. So the nasal septum is formed both by the bone and the cartilage. So the bone which contributes to the formation of the nasal septum are perpendicular plate of ethmoid and vomer, and cartilage which contributes to the formation of the nasal septum are the septal cartilage and septal process of the inferior nasal cartilage. Okay, so with this I'll continue on to the next slide. So you can see the nasal septum here. Okay, so it has a superior border and has an inferior border, and it has an this is the anterior border, and you have the posterior border also. Okay, and it has two surfaces, right and left surface, which is covered by mucous membrane, and it is lined by ciliated columnar epithelium. Okay, so next we'll go on to the arterial supply of the nasal septum. Okay, so arterial supply of the nasal septum, first for this, okay, you have to divide the nasal septum into, okay, four quadrants. Okay, so how will you divide this? Okay, so just I'll draw schematic diagram here, how to draw the blood supply here. Okay, so just to draw one part like this. Okay, so here you just, okay, so you divide this into four quadrants like this. So this part is the antero-superior part, and this is the antero-inferior part. So this is the posterior-superior part, and this is the posterior-inferior part. Okay, so you divide the nasal septum into four quadrants like this. This is the antero-superior part, this is the antero-inferior, this is the posterior-superior, and this is a this is posterior-superior, and this is posterior-inferior part. Okay, so after drawing this, okay, you just label, you can write here, or you can, what you can do is you can just draw the artery like this. Okay, so here it is supplied by the anterior ethmoidal artery, okay, which sends branches also to the inferior part of the nasal septum, and the posterior superior part is supplied by posterior ethmoidal artery. It's a very short artery. Okay, so the antero-superior part here, it is supplied by anterior ethmoidal. The posterior superior part is supplied by posterior ethmoidal artery. Okay, and you will have the posterior inferior part here. Okay, it is supplied by the sphenopalatine artery. Okay, it is supplied by the sphenopalatine artery here. Okay, and here the sphenopalatine artery, even it goes to the antero-inferior part of the nasal septum. Then the antero-inferior part of the nasal septum is supplied by the superior labial branch of the facial artery. Okay, I think now you are clear. So this branch is the anterior ethmoidal artery. Okay, This is anterior ethmoidal artery. I'm not good in writing. Okay, so I'll skip this. I think you are clear with the schematic diagram. Okay, now we'll go on to this picture. So this antero-superior part is supplied by anterior ethmoidal artery, which is a branch of ophthalmic artery. Then posterior-superior part is supplied by posterior ethmoidal artery, a branch of ophthalmic artery. Then antero-inferior part is supplied by the septal branch of the superior labial artery, which is a branch of facial artery. Okay, then posterior inferior part is supplied by the sphenopalatine artery. Okay, so now you can see except posterior ethmoidal, all other arteries, it forms an arterial anastomosis at the antero-inferior part of the nasal septum here. Okay, so in this anastomosis, even the greater palatine artery will contribute. Okay, so in the next picture I'll show, you can see the greater palatine artery runs along the alveolar margin on the undersurface of the hard palate. Through incisive foramen, it enters the floor of the nasal cavity and it anastomoses with sphenopalatine artery and even with the superior labial branch. Okay, so now the anterior ethmoidal artery and the branches of sphenopalatine artery and branch of greater palatine artery and branch of superior labial artery. So all these arteries undergo anastomosis at the antero-inferior part of the nasal septum and it forms an arterial plexus here. This plexus is called Kisselbach's plexus. So the area where it forms anastomosis is called Little's area. Okay. So I think now you are clear what is Little's area. Okay. So the Little's area is nothing but the anterior-inferior part of the nasal septum is called Little's area. So where all these arteries anastomosis. So what are the arteries? Anterior ethmoidal. The posterior ethmoidal will not anastomosis come to the anterior-inferior part of septum. This will end in the posterior superior part itself by anastomosing with anterior ethmoidal. Okay. And the branches of sphenopalatine, greater palatine and branches of the superior labial artery. Okay, so actually if you see the applied aspect, so this is the commonest area we used to prick the nose and even children they used to prick the nose here. Okay, any injury, what happened, this arterial anastomosis will get disturbed and they will start bleed. Okay, so this is the area of epistaxis, the commonest site of epistaxis. So epistaxis nothing but the bleeding from the nose. Okay, so the sphenopalatine artery is otherwise called artery of epistaxis, which mainly contributes to this anastomosis. Okay, I think now you are clear about the Little's area and the arterial supply of the nasal septum. Okay, so next we'll go about the venous drainage of the nasal septum. Okay, so now this venous drainage we divide into two parts, anterior part and the posterior part. So the anterior part, mainly from Little's area, the venous plexus will drain into the facial vein. Okay, and from the posterior part through sphenopalatine vein, then it drains into pterygoid venous plexus in infratemporal fossa. Okay, so these are the two important venous drainage of nasal septum. Other than this, actually the veins, they will accompany the perineural sheath which is present in the perineural sheaths of the olfactory nerve rootlets, and through this it goes to the cavernous sinus. Okay, through this it drains into cavernous sinus and through nasal vein in foramen cecum it goes even to superior ophthalmic vein. Okay, so now through this actually even the infection will spread to the cavernous sinus. So this part, antero-inferior part of the nasal septum is also included in the dangerous area of the face. So which is one of the important thing for anastomosing with the cavernous sinus. Okay, I think now you are clear with the venous drainage of the nasal septum. So next we'll go on to the nerve supply of the nasal septum. So the nerve supply, here you have special sensory nerve and general sensory nerve. The special sensory nerve is mainly carried by the olfactory nerve, which is present in the roof of the nasal cavity. So this olfactory nerve rootlets through cribriform plate of ethmoid, they all join here to form the olfactory bulb. From there it goes to the olfactory tract striae, then the olfactory area of cortex. Okay, so this area is called as the olfactory area. Okay, now if you see the general sensation of the nasal septum, so here also you divide this into 4 quadrants like this. Okay, so now the antero-superior part of the nasal septum is supplied by the anterior ethmoidal nerve, which is mainly a branch of the anterior ethmoidal nerve is a branch of which I think you will remember it is a branch from which nerve, nasociliary nerve, which in turn is a branch of the ophthalmic nerve. Okay, so if you see the particular branch of anterior ethmoidal nerve, this is the internal nasal branch. If you are not able to remember internal nasal branch, then simply remember a branch from anterior ethmoidal nerve. Okay, or even you can remember septal branch of the anterior ethmoidal nerve. Okay, the antero-inferior part of the nasal septum is supplied by anterior superior alveolar nerve. Okay, so anterior superior alveolar nerve, I think you know it is a branch of which branch? Maxillary nerve. Okay, and if you see the posterior superior part of the nasal septum, it is mainly supplied a branch from the pterygopalatine ganglion, that is a medial posterior superior nasal branch of pterygopalatine ganglion, and it is even also supplied by the nerve of the pterygoid canal. Okay, and if you see the posterior inferior part of the nasal septum, it is supplied by a nasopalatine nerve from pterygopalatine ganglia. Okay, so I think now you are clear with the nasal septum. So while reading blood supply and nerve supply, you divide the nasal septum into 4 quadrants. Schematic diagram is enough, and you just mark one line like this, and you write here. That is enough. No need to write the explanation here. This, if you put a box like this and if you write, that is enough. Okay, I think now you are clear with the nerve supply of nasal septum. So next we'll go on to the lymphatic drainage. Okay, so if you see the lymphatic drainage of the nasal septum, it is divided into anterior half and posterior half. So the anterior half of the nasal septum drains into submandibular lymph node. The posterior half and the intermediate region here both drain into retropharyngeal lymph node and even to the deep cervical lymph node. Okay, so I think you are clear. And through olfactory nerve fibers, that is perineural sheath covering the olfactory nerve fiber, through this it will go to the subarachnoid space also. Sometimes the lymphatics will go to the subarachnoid space also. So that's why any airborne viral infection may cause, okay, meningoencephalitis. Okay, so even in corona infection also, so far they have not elicited this meningoencephalitis, but it may cause, because this is again, this coronavirus is an airborne infection. So through the olfactory nerve rootlets, it may affect the brain. Okay. Okay. Next, we'll go on to the applied aspect of the nasal septum. Okay. So you know the epistaxis is the bleeding from the nose, that is mainly due to the nose pricking, or sometimes in case of hypertension after 60 years. Okay, in if the patient is having high BP, suddenly they may go for arterial bleeding. So this will protect the intracerebral bleeding, and it even will protect the brain. Okay, and other than this, any trauma or any infection may cause epistaxis. Okay, so next important applied aspect of nasal septum is the deviation of the nasal septum. So normally, if you see, most of the nasal septum will be deviated. Okay, only few will have a straight septum. Okay, most of us will have the deviation of the nasal septum either to the left or the right. Okay, this will obstruct the other airway. So with this, the patient will have the nasal block, and the allergic rhinitis are very common in case of deviation of nasal septum. Okay, so even the patient will get sinusitis because of the deviation of the nasal septum. Okay, and even it obstructs breathing, and the patient will snore. Okay, I think most of you will have, even I am also having the deviation of nasal septum. You can see the deviation of nasal septum, if it obstructs the breath and if it disturbs much means we can correct this. Okay, so the deviated part of the cartilage will be removed and it is reshaped and we can keep it straight. Okay, so this is one corrective surgery for deviation of nasal septum. Okay, so next important applied aspect is the septal perforation. Okay, so septal perforation usually if the patient is working in very high temperature areas like boilers, or if they are inhaling very um, mm, high temperature air, so in that case it may go on for septal perforation. Okay, so next other applied aspect is if there is any infection of nasal cavity, then this condition is called rhinophysitis, means inflammation of the nasal cavity. Okay, this may be due to common cold or bacteria, and allergic rhinitis are more common because of the hypertrophy of the inferior nasal concha due to chronic blockage, that in case of deviated nasal septum. Okay, so you can see the enlarged inferior turbinate will block the nasal cavity. This may cause the allergic rhinitis. Okay, so other than this, one more important aspect is if there is any fracture of cribriform plate, so the meninges which is attached to the cribriform plate will undergo tearing, and this results in CSF rhinorrhea. Okay, so with this I'll finish the nasal septum. Okay, and you can see some cadaveric images of the nasal septum. This is again the sagittal section of the head and neck. You can see the nasal septum here. Okay, so this is the oral cavity. You can see the hard palate, and this is the soft palate. This is, you can see the sphenoidal air sinus. This is frontal air sinus, and here is the nasopharynx. Okay. So in the next picture, you can clearly see the markings of the septal cartilage, perpendicular plate of ethmoid and vomer here. And you can see the nasopharynx, hard palate, oral cavity, and tongue. Okay, this is a high power view. Okay, so next here, a part of mucosa is removed in the posterior superior part of the nasal septum. Here you can see the olfactory nerve rootlets, which is entering the cribriform plate here. You can see the olfactory nerve rootlets here. Okay, and after removing the nasal septum, you can see the lateral wall of the nose, which is irregular, which has three concha, self-like projection, and the space below that here is called as the meatus. Okay, you can see the meatus. So this antero-inferior part of the nasal cavity here, it is called as the vestibule of the nose. This part is called as the vestibule of the nose. So this part is provided with some hairs and even it is covered by skin. Okay, and you can see the auditory tube opening in the nasopharynx, which is behind the nasal cavity here. This is the auditory tube opening, and you can see the tubal elevation here. Okay, this is the soft palate here. Okay, so you can see this is the roof and the posterior wall of the nasopharynx here. Okay, and you can see the tongue. Okay, so with this I'll finish this today's session. I think you are clear with the nasal septum. To summarize the nasal septum, it is made up of both bone and cartilaginous part. So the bony part is mainly formed by vomer and perpendicular plate of ethmoid. Cartilaginous part is formed by septal cartilage and inferior nasal cartilage. Okay, so the arterial supply is mainly from our anterior ethmoidal, posterior ethmoidal, sphenopalatine artery, and from a branch of facial artery. Okay, the venous drainage into facial vein and pterygoid venous plexus. And if you see the nerve supply, so olfactory sensation is taken by olfactory nerve rootlets, and general sensation is taken by the anterior ethmoidal nerve. Then nasopalatine nerve from pterygopalatine ganglion, and from the another branch from the pterygopalatine ganglion, and from the anterior superior alveolum, which is a branch of the maxillary nerve. Okay, so the lymphatic drainage, the anterior part into submandibular node, posterior part into retropharyngeal and upper deep cervical node. Okay, so the upper part through perineural sheath covering the olfactory nerve rootlets, it may even go to the subarachnoid space. Okay, so with this I'll finish the today's session. Okay, so if you have any doubt, you can clarify.